Hi everyone, I'm Dr. Lin of Rehab and Revive Physical Therapy. Today hasn't been such a good day, but I did want to shoot something, and I realized I woke up with a pinched nerve, or what people believe is a crooked neck sometimes, and it's really, there's a lot of strain right here. I've been kind of having to walk around like a mummy, and those of you who have this might be feeling it right away. There's actually a great thing I do teach patients, and it helps and works right away. So I immediately started doing it and made massive improvements. So what this is a stability test of the head and neck. And I've adapted this from my mentor Greg Johnson, his impact test. I just do it for the head and neck purely. So what should happen is if you have that strain, I have it today on the left, and what happens is if I push very lightly, it's gonna knock me over, and there's usually some level of discomfort. What you want to do is you want to be able to re-educate, and thinking about the 6 points that I've talked about in the previous video, we'll link that below. This is very important to get that re-education back, that reflex back. We want to have that mobility of the internal and external mobility, but if we can get this right away and reinstate and reintegrate these neuromuscular patterns, you're gonna fare off a lot better. So I've been doing this quite constantly all day today, and what the goal really is how do you do this? It's going to be able to, you want to be able to push up towards the ceiling, and then you hold it. And I start very light. Notice how my elbows are very narrow, and then I want to push up. So those are the 2 steps. Keep your elbows narrow and push up, and just hold that. And you want to, you might feel some muscles like twitching or starting to shake a little bit, and those are the deep muscles trying to help out. They're trying to help in and kick in to give you that nice collar, because those of us that have woken up with crooked neck, I would say oftentimes feel like you just want like someone to hold that neck sturdy, and then you can move on with the rest of your day. So you have to superimpose and reintegrate that back into your system. Some other great ones and other reasons that this is a great exercise is those that I believe with not just the pinched nerve, so that's number 1. Number 2 would be those with some numbness or tingling that are going down their arms. Sometimes it's a great help. And then number 3 is migraines, jaw pain. A lot of times we need that base here to then help out your jaw and your headaches. And then finally, just that general neck tension. Everyone wants you to massage, or you want someone to massage right there. This is a great exercise to show people. But start here neutral, and then I ventured off neutral, and you can see right here it's still weak. I can hold all these other positions, but this one just doesn't do good, and this is the nerve that's pinched right here. So you're gonna hold that here, and these are good. So I want to re-educate on this spot. So you just venture maybe 5 degrees, 5 or 10 degrees, a little bit further, and then you want to hold it. What you should feel is a deep kind of hold or lock underneath inside your neck, as well as a core kind of activation here. So you want that activity there, and then there it is, and now it's just starting to kick in. Just check it. I definitely want to check this constantly. I generally tell patients just every 30 minutes to an hour. Make sure you check this with your healthcare practitioner and do it at your own risk if you haven't. Make sure this is the right exercise for you, but especially those that just wake up with a crooked neck, boy, we want to get it right away, and then definitely ice. And so I've been doing that all morning and being able to treat patients this afternoon. So once again, if you like what we're doing, please leave a like below. Subscribe to our channel. There's always something interesting here that happens to my body or our patient's body. And subscribe and leave comments. We always feed off your comments, and we always try to make changes as much as possible. I'm Dr. Lin of Rehab and Revive Physical Therapy. Remember, we can and we will get better together. This is a summary of our head and neck stability test, as well as re-education. So what you want to do is think of these 4 quadrants, these poles, north, south, east, west, and then you want to check them real quickly. And if it feels like there's a little jig, that's what you need to do, is then you re-educate it right on the spot. And you do, like I said in the video earlier, is that we want to be able to check different degrees of what's available and see if that's still intact. How you retrain it is then you take your palm and you slide on your skin. We call that a skin lock, and you want to traction up towards the ceiling, and then you hold it. You hold it until the deep muscles, deep cervical flexors and stabilizers work out, as well as your core muscles. If you're only just feeling it here, it's a short anchor. I tell people you want you know, a thing that's stable is a boat that has the anchor that goes down to the sea floor. So you want it to go down to the sea floor, which is your core. And that's when you have it. You get your pelvic floor, and all these things start getting involved to help reintegrate. You know, those structures that heal often definitely need to be reintegrated.